Hello and welcome to episode 63 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is injections. Injections versus placebo. Do they do anything? Are they helpful? Are they all cracked up to be what your primary physician or other doctors that want to do injections are telling you and trying to convince you to do? I don't know. Let's talk about it a little bit, okay? So, first off, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program, and you get exclusive access to myself. And I just posted my full 8-minute lower body warm-up in there. That is the only place it has ever been posted, and I have detailed every single movement, and I'm answering questions in the comment section. And I discussed this a little bit on episode 62 of this podcast, going into the best ways to structure a warm-up, and how to get optimal results for your lower back, for your rehab, for your warm-up, and the methodology behind why I do that warm-up in a particular order. So go join the Facebook group. There's thousands of dollars worth of free advice in there that you will not get on my other platforms. So let's jump right to today's topic, okay? Today's topic, injections. So many of our clients have had injections, so many. And we hear the same story most of the time. About 90% of the time, individuals say it did nothing. Maybe a day of relief, but nothing. Nothing long-term. That's about 90%. A 5% will probably say it made them worse. Another 5% will say it did make a significant impact and it actually lasted for a few months, but it's not gone. That's because obviously they're not doing whatever is needed to be done to address the root of the issue, but the injection substance was helpful for that particular scenario. But probably 90% of our clients, maybe more, who listed they had an injection, all say it did either absolutely nothing or it worked for one day and it came right back. So let's see what the evidence says, okay? This is one of many papers, but this is one that particularly covers a lot. So this article, it'll be linked in the show notes, is called Pain Management Injection Therapies for Low Back Pain. And what they did here was they looked at 78 randomized trials of epidural injections. So this covers 3 different types of injections, okay? This covers your classic low back injection for sciatica, your epidural cortisone injection. This is facet injections and SI joint injections. So here's what it immediately says. We'll jump right into the results here, okay? Or at least the outcomes, okay? So what they found was that the trials of epidural corticosteroid injections for radiculopathy, for sciatica essentially, versus non-placebo interventions, so interventions that were not injections but also were not placebo, they did not clearly demonstrate effectiveness. Okay? So the injections did not demonstrate effectiveness over alternative methods. The magnitude of effects on pain and function were small and did not meet predefined thresholds for minimum clinically important differences. And there were no differences on outcomes at longer term follow-ups. I apologize. So this is what the evidence says about those injections that everybody is getting. Oh, back pain, injection. Sciatica, injection. Boom, boom, boom. They get a nice reimbursement through insurance. You get a nice, usually fat stack of nothing, or a big bill in the mail that you were not prepared for. We've had clients that have spent $3,000 to $4,000 out of pocket for a single injection and got no results. That's going to burn. Invest that into a coach. Invest that into a program to teach you how to fix yourself, okay? You'll get a lot more per dollar. Additionally, let's go through the rest of these, okay? Evidence was limited for epidural corticosteroid injections versus placebo interventions for spinal stenosis or non-radicular back pain, and showed no differences in pain, function, or likelihood of surgery. Okay. Now for facet joint injections, studies found no clear differences between various facet joint corticosteroid injections and placebo interventions. You hear that one? Facet joint injections and placebo interventions. No differences. No differences. Facet injections, placebo, no difference. I would advise against that one. That's going to be a big old bill to do a whole lot of nothing when you could get placebo instead and have the same outcome. Okay. Now, serious harms from injections were rare in randomized trials and observational studies, but harm reporting was also suboptimal. So rarely is it going to make things a lot worse with these types of injections. Now, nerve ablations commonly make things worse. Injections, they can make things worse, but at least not commonly, but it's not often reported, okay? So the overall conclusion of this paper: epidural corticosteroid injections for radiculopathy were associated with immediate improvements in pain. That's what some of those people experience. They will experience immediate pain reduction. A lot of people do, whether it's one day or 1 week, and that's it, is besides the point. But you typically will experience some improvement in pain, just very limited. Might be associated with immediate improvements in function. If there's less pain, you're going to move more. It doesn't mean the low back issue is fixed. You could pop some Vicodin or some oxycodone, right? And you'd be able to move better. Functions improve, but you're just covering up the symptoms. We all know this. But the benefits were small and not sustained. That's the overall conclusion here. Injections for low back, injections for sciatica, improvements were small and not sustained. This is the conclusion for majority of injections. Okay? So all the more reason why you need to really focus on investing into education, investing in movement. Education and exercise will always be the number one source for low back pain relief. Always. It's always been, it always will be. There is no quick pill. The quick pill you're looking for your back pain is called investing your time and energy. That's the quick pill, is getting a proper assessment, having someone coach you through the right movements that you need for your low back condition, and then doing it consistently. That's the magic pill. Takes some work. Takes a professional to guide you. Takes some investment on your end. There's your magic pill. So the reason I'm making this is to clear things up a little bit about injections, because like I said, almost every single one of our clients have tried injections before. It's not getting many people many places. They're being promised the world with these. They cost a lot of money for a very minimal result, and they're being pushed on a lot of people. And in other studies, they even found that it actually did tend to lead to more surgeries. Those who received injections tend to go down the route of surgery versus those who don't. So it can increase your chance of surgery in certain circumstances. And there's many reasons behind that. A lot of it could be the narrative that those providers are providing in those particular studies. But regardless, there's very rarely a good outcome. Even for people who do get immediate improvement and it lasts, it still only lasts so much. So for very, 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 very rare circumstances, could you have a scenario where you're like, yeah, I got an injection and I feel a lot better, and now I feel good enough to start the next phase of my rehab? That should be the goal with injections, but very rarely does that happen. Extremely rarely. So, as I stated, invest in education. Invest in exercise. Invest in an expert and a coach who can guide you through these processes, because you're going to get way better results. You're going to learn how to get out of pain and how to keep yourself out of pain. And of course, you want the results to last. So why wouldn't you learn how you can make them last on your own, right? It's like the difference between someone who wants to lose weight and they're doing liposuction versus lifestyle modification. Lifestyle modification is going to be more successful 1,000 times out of 1,000 times. We all know this. If you don't correct your behavior, if you don't correct your movement, if you don't correct the factors that are influencing, in this particular situation, your pain, it's not going to change anything long term. Something's going to regress. Something's going to come back. And this is what we see all the time. So I'm trying to help you make the best decisions in your health that you possibly can. I'm trying to help you not go down paths that might not be worth it for you. Because remember, knowing what not to do can be just as important and valuable as knowing what to do. If we can save you from going down routes that are costing you thousands of dollars and thousands of hours of wasted time dealing with pain, that is extremely valuable. The more and more bad advice you have, the more valuable you realize good advice is. Okay? And that's why most of our clients who have been dealing with issues for, 4 to 5 years on average, who've seen a couple chiros, a couple PTs, an injection or two on average, are tired of receiving mediocre advice. And the second they are instructed to do a movement that provides immediate results, which typically we find during our assessments, usually 20 to 40% improvement is the average that we see during our assessments live. And they're like, oh my gosh, why wasn't this provided to me sooner? Why was I just told, oh, you just got to be patient. You just got to be patient. Just get this injection. Be patient. Be patient. No, you should not have to be that patient. You should see results pretty quickly if you're doing the right things and if you have the right plan. So let us help you save a ton of time, a ton of money, a ton of heartache, a ton of pain, okay? And just know what to not do. Knowing what to not do can save you so much. So much. It can be so valuable. So I hope that you found this beneficial and maybe learned something about injections and maybe reconsider the next steps that you might be taking in your low back journey, in your sciatica journey. And if you have not, once again, joined our Facebook group, RehabFix Low Back Program, you need to join our Facebook group so you can get more valuable information just like this. And ultimately, if you're finally tired of the pain and you just feel like, you know what, I'm just tired of figuring this out on my own. I'm tired of trying to figure this out. I'm not a low back doctor. I'm not going to pretend to be. I'm just tired of dealing with this. I'm tired of guessing through all these YouTube videos and Instagram videos. And that means it's time to do something serious about it and reach out to us so we can have the opportunity to help. You're listening to this podcast for a reason because you're invested in this information. So if you know it's time to make a change, then let's do something about it. Give us the opportunity to help you and show you what that plan will look like so you can get out of pain and get back to living the life that you want to live. If you're watching on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review. Join our free Facebook group. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.